Just a second. I'm going on to YouTube to see what's going on. All right. We're streaming under the Historic Resource Commission. So Angelica, I'm going to give you a new stream key. I'm just going to give you the new YouTube link and put that in as the YouTube link for this meeting. Stand by. Control copy. Wait, hold on. What did I do? I think I have so many tabs open. It's going slow. Resources. And once you change that, it should link us to public input and then send the message to Ben. I'm going to put it in GChat for you. Actually, I'm putting it in the chat for the meeting because everything is updated on my computer. There you go. Good evening, everyone. We're here tonight to discuss the proposed emergency shelter at the Ramada Inn near River Ridge in East Asheville. This is going to be a question and answer informational. We received a lot of questions from the community and would like to provide as much information as we can at this point. We'll be addressing questions received in advance. So let's start out first. Let's do a round of introductions from the members of our panel. I'll kick it off to Kathy first.
Good evening, everyone. I'm Kathy Ball. I work for the City of Asheville.
Tara and Ashley, do you want to go next, followed by Emily?
Good evening. My name is Tara McCracken. I'm the Director of Workforce Development for Goodwill Industries of Northwest North Carolina.
Good evening. I'm Ashley Lung. I'm the Shelter Coordinator, and I work for Sunrise Community for Recovery and Wellness.
Hi, thank you all for joining us. I'm Emily Ball. I'm in the Community Development Office of the City of Asheville.
Thank you, ladies. I look forward to hearing from all of you tonight. Can we start out with a description of what's going on with this initiative right now? Kathy?
Thank you, Ashley, and thank you all for joining us tonight. I'd love the opportunity to be able to talk to you about what the City of Asheville and other partners have been doing with regard to making sure homeless folks are taken care of during COVID, and then speak a little bit more about the initiative that we have going on right now. Since COVID began, we knew that a very vulnerable part of our population was at risk. And so the city, along with other partners, have been working in various ways to be able to provide shelter for homeless folks that would protect them from COVID, as well as protect them from infecting other folks. We've done that in different ways. We've had congregate and non-congregate settings, and most specifically, I wanted to speak a little bit about the experience that we had with the Red Roof Inn. The Red Roof Inn was a project where we housed approximately 150 some folks over a period of about 1 year. And of those, we had 40 some folks that were able to get permanent shelter during that time. We did that because the FEMA, the federal government, was offering reimbursement money to be able to house folks in non-congregate ways. So as we were beginning to look at how we protect folks who are in crisis, who are homeless, we were able to use that as an example that actually worked in our community. In March and April of this year, we started to see a lot of folks camp in parks, city parks, and to the point that there were encampments being established, and the folks there were creating hazards for themselves as well as adjoining neighborhoods, as well as people who were attending the parks. We started working on trying to get those folks housed in some way, and we had the opportunity through another federal grant program, the American Rescue Plan money, to be able to house folks in a non-congregate setting. So we started that process because of the success we'd had with the Red Roof Inn. And we started housing folks in a few different hotels around the city, and then started looking for the opportunity of where we could possibly do this and use the federal funds to be able to provide wraparound services to folks, to be able to help them stabilize when they were in the most crisis. So that brings us to today. We're coming to you because we have a contract to purchase the Ramada Inn in East Asheville, and we want to be able to answer your questions and concerns about it. We have approximately 88 folks housed at that location, many of them, and Ashley and Tara will speak about this in a little bit, about the ways that we're trying to provide services so that these folks can go back to work and be able to come out of crisis and be housed. I will share with you that our model through this program has been a housing first model. So in short, I wanted to go through the history with you to tell you that we had experience doing this recently, and we found a large amount of success, but we also acknowledge that there's a lot of concerns. And so that's why we're here tonight, to be able to answer some of the questions that you all have and concerns that you all have about the proposal that we've put forward. So Ashley, I hope that answers your question. I'm happy to expound on it if you think that it would be good. I think that we may have lost Ashley right now, so I'm going to go ahead and move forward and ask a few questions. And Emily, I'll ask you this first one, and then we'll just kind of pick up and go around, and y'all just chime in whenever the question may be appropriate. One of the questions that we got is, what is the city seeking to accomplish through creating the emergency shelter?
Great. Well, I would say our focus at the city is always on ending homelessness. We want fewer and fewer people to be experiencing homelessness in our community all the time. We have an eye on the prize of that goal in all of our initiatives. But over the past year in particular, it's obviously been a difficult year for all of us in a number of ways. Over the past year, we have seen our data really go in the opposite direction. So we do a count every year that identifies how many folks are homeless on a single night in our community. And in the 2021 count, the number of people who were unsheltered, meaning they were staying outside, so they were camping, maybe in a car, but on the street, the number of people who were unsheltered doubled in 2021 compared to the folks that we were able to connect with in 2020. So really growing unsheltered population. And I think it's probably clear to all of us that we are in a really different climate in our community right now than we have been in the past in terms of homelessness. And that means that we need a different response. And so we have known for a long time that, we've of course always had some people who are unsheltered, and have known for a long time that there was a group of people who couldn't go into shelters or wouldn't go into shelters that we currently have in the community. And our job at the city and our job as a community is really to continually evaluate what the needs are in our community and how do we end more and more homelessness? How do we adapt our system constantly in order to best meet the needs as those needs are emerging? And we want to always be learning about what is effective. And a model that has really gained a lot of prominence across the country in the last several years is two things. Is one, a non-congregate approach, which means that you provide people their own space rather than a large room where people are staying together. That was a big learning in our professional field that came out of the pandemic. And the other is that if you develop the type of shelter, if you talk to people who are unsheltered about what their needs are and you develop the type of shelter that they need, they will take it. They will come inside and receive those services. So this is a long answer, but what we are trying to accomplish is that we know we have really great shelters in our community, and those shelters address the vast majority of the need in our homeless population. If you look at the data, most people are in shelters or in transitional housing, but we do continue to have this group and growing group of people who are unsheltered. And so we need to develop a new intervention that's really specifically engaging those folks to create better opportunities for them to come inside, to be safe, to stabilize, and ultimately to exit to permanent housing. Because again, our goal always is to decrease the number of people who are experiencing homelessness by moving people into permanent housing.
Thank you so much for that, Emily. Tara and Ashley, could you kind of discuss with us some lessons we've learned from the current operations?
I wasn't sure who was going first. Some lessons we've learned, well, for me being on site at the shelter quite a bit, is it's extremely difficult to run an emergency shelter with an actual operating hotel. I know that the plans for the future will make it a lot easier to be able to provide the services and the security that our folks need and that the surrounding communities need, because it's very difficult when there's two coinciding businesses trying to work as one. And some other lessons we've learned are, like Emily was saying, a lot of these folks, like they want housing, they want to be housed, they want to be sheltered. So we just have to get in there and to learn like what's working for them, what's not working for them. And I have been able to build really good relationship with some of our folks and learn about what their needs may be and how we can help meet them in the shelter.
Yeah, absolutely. So we've been fortunate enough to be on site to provide some job search assistance and overall support to the folks who are staying there. And I think the biggest lesson that we've learned is that trusting relationship is so important. These are individuals who have a lot of different reasons for being unsheltered. And unless we can sit in a room together and develop a trusting relationship, we don't know what they really need in order to become sustainable and work through barriers. They've been with a different type of community outside or wherever they felt comfortable. And this is sort of a new way of life. We're thinking about it in a new way. And so for us to be able to really engage in conversation and ask, how long have you been here? What are you thinking that you're struggling with? What services do you need? Do you just need assistance with finding your driver's license? Sometimes it's that simple, and sometimes it's a lot of other needs that help them to get to a more sustainable place. So it's been an eye-opening and powerful experience for our staff that we've been able to engage and just really learn how we can assist these individuals in a better way.
Apologies, team. We had a little technical difficulties. Ashley and Tara, were you able to answer that question before we move on? Okay, we're good. So we're going to be going to just a question and answer period. So everybody, please feel free to chime in. We're going to begin with some questions about the history and background of the proposed emergency shelter at the Ramada Inn. I'm going to start with the first question. And we kind of talked about that before. What are some successes that we've seen? But any additional successes that we want to add for our listeners to hear tonight?
Yes, because I've touched on a lot of the lessons learned in the last one. So there's definitely been a lot of successes. I've been with these folks since day one, since the day they were moved into the shelter. I could probably tell you all 85 by name. Just some recent successes is we had a mother who recently gave birth to her child. It was a little boy, and she decided that being in the shelter was probably not the place for her to be able to successfully raise her child. So she let us go through all the paperwork with her, all the application process, and Sunrise and the city, we were able to get her into Transformation Village, where she's able to have her child with her, and she's able to be a parent to her child. Folks didn't even have that. We had a gentleman with a shoe size that was too big to buy normal boots, and we were able to get him a pair of boots so he could go do his job. And just by Sunrise being on site, we're certified peer support specialists. So we have lived experience in a lot of these ways. So we can relate to our folks, and they see that way that we're living our life today and the fact that we used to possibly be where they are, and they see how much growth and how much opportunity they have. And just in that, we've had multiple peers want to go to long-term treatment for their mental health or their substance use. So for me, that is a huge deal. And I just continue to see successes, and I know there's going to be so many more.
Ashley, those are some really, really great stories to hear. And I think that it will really help our community when we're pushing this conversation forward to hear those successful stories. On the flip side, what are some challenges that, we face? And anybody can definitely chime in on this one.
So I will speak from the concerns that we've heard from adjacent property owners. We want to acknowledge those because we do. I think Ashley mentioned earlier how difficult it is to run and have folks staying in a location when there's not controlled access, when there's other visitors at the site. When there's just not ability to provide all the wraparound services that folks need. There have been issues with adjoining property owners feeling that there are safety concerns, including drug paraphernalia, folks going through dumpsters, folks kind of showing up or laying on sidewalks, things of those natures that we know are concerning to adjacent property owners. I know Ashley, Tradham Carson, we have talked that there will be an opportunity for us to talk specifically about safety concerns later on. So I don't want to take up too much time right now going into those because we know we have a lot of concerns from folks around that. But I think the difficulty that we've seen is, from my perspective, and others may have other things to share, but just the difficulty of operating it not as a full emergency shelter in the way that we would like to.
Thank you so much for that, Kathy. Our next question, when did the city decide this was a good location for a shelter? I'm going to pitch that one to Kathy as well.
So let me make sure I understand, Ashley. Your question was, when did the city decide that it was a good location?
I'm sorry. Why did the city decide that this is a good location for the shelter? Sorry about that.
Thank you. No problem. So the city, based on our history of working at the Red Roof Inn and talking to other peer cities, we saw that a lot of communities were using the money they got from the federal government in order to help the most vulnerable affected by COVID. And this was something that other cities were doing. We started looking at locations that may provide the right kind of access, that may have the surrounding amenities that folks would need. And we narrowed it down to 3 sites, and we did an evaluation of those sites in terms of the cost, the ability for growth to happen at those locations that may provide other services, access to transit, access to other services, the ability of wraparound service providers to come on site. And so this property is over 6 acres and has a land that could later have a building on it. It has 2 existing hotel buildings that are walk up without elevators. And so there were a lot of things. The rooms are interior facing, which in research we have learned is a good, safe way of providing non-congregate shelter. So in many ways, this piece of property checked a lot of boxes, as well as being the lowest cost of any of the other ones we looked at for the highest number of rooms. And team, if I've left out something, please add anything that I may have left out in terms of kind of the analysis that we did around selecting this piece of property and recommending it.
And team, I promise we're going to get back to our panel, but our next question we're going to throw to Kathy as well and that is, why has this happened without any community involvement? Kathy?
So I think that is a legitimate question. We met with the Coalition of Asheville Neighborhoods, and they specifically asked this question. I think that when we decided, as we were relocating folks from encampments. I spoke about that earlier in March and April, and we were moving them into hotels, and we felt like one of the hotels that we had selected was this location. And so when we had landed on this location and knew that we had funding from the federal government that would be coming, we identified the adjacent property owners. And so we very quickly, as soon as May, so the first move-in of folks was April 19th. In May, we started meeting with the adjacent property owners. And our focus was on adjacent property owners specifically because we wanted them to know what was happening next door, and we wanted to be good neighbors. So we spent most of our energy and effort in May, June, and July identifying and working with the adjacent property owners. I think some of the folks that we heard from were neighborhoods that were within half a mile to a mile in proximity to this site. And so we have now, in working with the property owner, felt like we could reach out and have conversations with them and welcome their input.
Thank you, Kathy. So our next question, some feel the city must address homelessness in a more permanent way rather than temporary housing that does not address the root problems our city and its population faces. Why does the city believe that this shelter is needed in our community?
I can speak to that. I would say the answer is both. We have to have both. It's absolutely true that the thing that people who are homeless need most is permanent housing, and we want to never lose sight of that. We want to be continuing to invest in programs that make those opportunities possible. We know that that works in our community. There's a lot of national data to back that up, but we also have good local data to support that. So absolutely, we want to continue to focus on permanent housing. And we also know that we don't have enough permanent housing tonight for all of the folks who are without housing in our community. So I think our role at the City of Asheville is to serve as the Continuum of Care lead, which is a HUD framework that essentially means our job is to look at the community as a whole, really treat this as a full system, and make sure that we have the right interventions that meet the need of people throughout that continuum of care. And so it means that we have to have crisis services because people are in crisis, and we also have to have permanent housing because permanent housing is the exit pathway.
Thank you, Emily. And another community concern, or community members have expressed that they have tried to help homeless people in their neighborhood who then refuse the help and say they don't want to go into a shelter. So in cases like this, why do we need more shelters in that case? Emily, Ashley, Tara, anything to add?
I saw Ashley come off mute, and I'm sure she'll have a good answer to this, but something that was so interesting to me in the current operation is that when we went into the campsites that were identified and talked to folks about the possibility of transitioning into a hotel room, 100% of the people that we talked to that night said yes, they agreed to come inside. And so I think we've had this long-standing narrative in our community that there are folks who choose to be homeless, that there are people who will never come inside, people who want to be unsheltered. And I don't believe that's true. That's not what I believe about humanity, but I also think we didn't see that happen in this particular situation. What we saw happen is that when we provided an intervention that was a better fit for the needs of those particular people, they did agree to come inside. So our goal, again, is to build out the mix of interventions that we have in our community, because we all have different housing needs. We all have different crisis needs. We need to have a good range of options for people, and we feel like this particular intervention will fill that gap.
Yes, and I did just want to add, because I absolutely agree with Emily. And just by talking with the peers, one thing that they have also said with coming into the camps and asking about the shelter is with the non-congregate, they really enjoy being able to go into a room, into a space where they can kind of let it be their own. And also the fact that, yes, I may be roomed with someone, but I may have a little bit of say-so in who I'm roomed with. It seems like it was it was kind of a good thing for them. And same as Emily said, whenever we just did a questionnaire with our peers, and almost 100% of them, their responses as to what they want their end goal to be is permanent housing. Thank
you for that, Ashley. So we're now going to transition and talk a little bit about safety. We understand that safety is a top concern for many community members. We like to ask some questions and read some emails we've received on that topic. Our first question: neighboring property owners have reported more needles, litter, graffiti, dumpster activity, theft, and crime in the area since the temporary shelter has been in operation. How would you respond to that?
I would say, first of all, I am sure that that is true. And also what I would say is that we know that's true across our community, not only in that location, but that's the same input that we have heard from many neighborhoods, many parts of our community right now. And I think that's back to what I said at the beginning, that it's a bit of a different climate in our community than we've had in the past. And we have a larger number of people who are unsheltered. And so a lot of those really specific activities come along with being unsheltered. And that's the specific problem that we are seeking to address by developing this new shelter intervention.
Thank you, Emily. Team, I'm going to read next some emails that we've received. And just for the people who are listening and watching online, I just want to give a brief trigger warning. Some of these emails are a bit sensitive. And once again, the city of Asheville respects all persons, especially our homeless population. So these are emails from our community, and they do not represent the attitudes of our panel and the city. So I'm going to read some of these emails. I'll read them all in their entirety, and then I'll throw it back to the panel. I'm going to start those. Sorry, I muted myself. You can't hear the emails if I mute myself. Here we go, team. The first email reads: I live in Verde Vista and absolutely do not want more homeless around it. I pay way too much money for my community to be trashed like half of what Asheville has already become. I work close by and see enough drugs, needles, homeless causing problems, weapons, cars being broken into, alcohol, and trash. Asheville is turning into an unsafe slum. Another question reads: please tell me how security for the neighborhood's homes, businesses, and schools can be properly provided, giving a low barrier shelter will not require IDs, will not administer drug or sobriety tests, and will even allow some patrons to check their weapons at night and retrieve them the next day as they leave. Our next email: the shelter does not allow residents to bring drugs, alcohol, or firearms into the shelter, but the residents have taken those activities into the neighborhood with drug deals going down in the parking lots and needles littering the sidewalks. What is the city's plan for discontinuing these practices? If approved, what level of security is guaranteed to prevent crime in this area? Given the issues raised in these emails, how would the panel respond to safety concerns?
So, Ashley, I do want to take a stab at being able to maybe pull apart some of these issues in a way that that people can feel heard, because we do respect all of our citizens. I think the first email that you read about the litter, the issues around drugs, weapons. I think Emily said this earlier, we're seeing that everywhere, not just in Asheville. We're seeing that across the country right now. I think we know we're living through an epidemic coming out of COVID and coming out of the crisis that we've had. We know that there's more gun violence around the country. I think that's why we're proposing this solution. So a lot of what the first email for me is about is us trying to solve that problem, us trying to help people deal with their addiction, to move to a better place, to help provide them with intervention that gives them an opportunity to not participate in the things that are causing issues and concerns for neighborhoods. So this is not, this is a solution to the problem that was mentioned. So I just want to say that I think that this is the way our community feels like it can address those issues, is by bringing people inside, providing wraparound services, addressing their medical issues as well as mental health issues and drug addiction issues. And I want to point out again that I think that the data we have even here in Asheville is showing that. So I think that's worth pulling out, that we are trying to give the answer to the problem. I think the other questions that are asked are around specific safety in this area. So one of the things we did as a part of looking at this site is ask the Asheville Police Department to help us identify ways of making it safer, making sure the residents were safer, as well as adjoining property owners. And so in moving forward with this project, we would propose that we have nice decorative gating that can have controlled access into it. One of the issues right now is quite simply not knowing who's coming and going. So it's very difficult to know who's entering the site, whether or not they have the authority to enter the site. So we would propose to invest very quickly in putting up fencing and having controlled access, additional lighting, providing sidewalks so that it's very clear where folks can walk and not be on private property. We want folks to learn in this area to be good neighbors. And being a good neighbor means that you treat your neighbors safely and with care. And so we feel like that is really critical. And one of the first things that we would propose to do, and in all the budget numbers that we have provided around this project, those are included as cost associated with doing that. And again, and a reminder, we've done all that in conjunction with the Asheville Police Department in trying to make sure that we provide safety for the residents as well as safety to the adjoining property owners. We don't want to ignore that there are issues. When we had the encampments, we had calls for service at those encampments that were significant and were very critical in nature. So again, I think my answers to the safety is we based on our evidence as well as across the country, believe that this will help address the issue of concern and safety that a lot of folks are expressing. And please, anybody else join in with other thoughts.
Anyone else from our panel before we move on? Thank you, Kathy. Our next topic is going to delve into operations. Many people have some very specific questions on how the shelter will be operated, and we like to address those at this time. We're going to start with Emily. And Emily, can you talk about who will run the shelter?
Yes, or yes and no is the true answer. We will certainly partner with an organization to manage the operation and to provide those on-site services that are really essential in safety, as Kathy just talked about, but also in helping people exit into permanent housing and get connected with other resources. We just published an RFP, a request for proposals, this past Friday. It's currently live on the city's bid page. To identify that shelter operator. So the no is that we don't yet have respondents to that. We are asking for letters of intent next week and final submissions mid-September. So we are in an active process to identify a partner who will operate that shelter, but we have provided some content in that RFP about the scope of work that we're looking for and the approach that we want our partner to use to be sure that this is a successful operation.
And Emily, I think that bleeds right into our next question. Who can check people in, police, fire, or other referrals?
Yes, all of the above. So, what I should also say about that RFP and shelter operator is that a lot of operational detail will have to be worked out with that entity once they're selected through this RFP process. So our intention is to really spend a few months on a deep dive policy and operations discussion with that partner to refine a lot of these details. But our vision for this is that, what we are looking for is a homeless shelter where homeless people will be able to check themselves in. So we certainly want this to be available to folks who are in crisis and seeking those services. We also want to be sure that we always have beds available for really specific crisis referrals. So law enforcement or EMS or the hospital system, we want to be sure that there's some dedicated capacity for those other systems to connect with.
And I know you've said that we're currently in this RFP process, so the scope may change, but what kind of services at this time will be on site at this new shelter? What do you envision?
As we talked about earlier, I think the ability to bring services to people in their location is really powerful. And so we do want to do a great job in coordinating with other community partners who are already serving the same population, but may have a difficult time connecting with them while they're in camps or on the street, have a difficult time keeping appointments and that kind of thing. So we think it will be really high impact to have those services located on site. And the scope of what we're looking for in that will be medical care, behavioral health care, as well as other partners like Goodwill. I certainly would invite Tara to jump in on this if she wants to add anything. But I think what we want to do is work with the shelter operator, work with the community, and work with people who are homeless about what their specific needs are and what would be most valuable to bring on site.
Yeah, I was going to say that that's really what we've learned, is had the opportunity to learn from the folks staying there, is that they've asked us and they've asked Sunrise, can you bring this entity on site? Can you bring this group to us? And because they're not used to developing, again, those trusting relationships with the community, the more services we can provide on site, the more likely they'll be to access those services, which I think is really powerful. And again, that just helps folks continue up or continue on to a different path in their life. So as Emily mentioned, obviously a variety of services will be provided. Employment is just a really, really small piece. And there's behavioral, physical health, and sort of takes all of that to be in the recipe for somebody to really be able to come out ahead or on the other side of their new life.
Okay, and speaking of services, will services be walk-ins or just for those staying there?
Just for people who are staying at the shelter.
And these are the next couple of questions are kind of, I guess, rapid fire. You'll probably have quick answers for. What's the meal arrangements and are pets allowed in the room?
So these are good examples of the type of details that we'll be working out with that shelter operator on the heels of the RFP process. But we certainly are expecting that food will be provided to people, and we want to be sure that there will be at least some food available 24/7 to folks who are staying there. And we do know that we want the property to allow pets. The particular nature of, where those pets stay and how that works operationally is the type of detail that we'll need to work out with that shelter operator. But pets are one of the reasons that people often don't come into shelter, and we want to be sure that that's not a barrier for anyone in accessing services.
Thank you, Emily. Our next question, what about rules or policies at the facility?
Same thing, that we will want to refine that in partnership with our shelter operator, but we do know that we want to, we have to ensure that this is a safe operation. Safety is paramount in any operation, in any social service, but certainly in an emergency shelter. So we want to be sure that all of the rules are really anchored in safety, that there is zero tolerance for violence on site, that, folks certainly may not be clean and sober when they arrive, but are not able to use once they're on site, not able to drink once they're on site. We want to be sure that we're striking a good balance of screening people in, but then making sure that we have a safe operation once people are there.
Thank you. And I'm going to toss this next question to Tara. Do you plan on any offerings of training or job opportunities?
We would certainly love to continue to assist with that. That's one thing that we have heard from the folks staying there, is that they want different access to GED classes. So there is a need and an interest to continue education, to finish high school. Again, as Ashley mentioned, we've been able to see people succeed in employment, and that's a big piece as well. So helping individuals look for work, bringing employers on site. We had the opportunity to do that as well as an employer come on site and speak to the folks that were staying there. And that's another way of providing that access to employment. In addition to not just employment, that wraparound follow-up services that we're all providing too, because we know that folks can find a job, but it's then helping individuals retain that employment as well. So that's a really critical piece, along with all of the other sort of interventions that should and probably will be provided on site.
Thank you very much for that. Our next question, how are you planning to ensure the accessibility, comfort, and safety of the shelter for transgender folks seeking shelter?
Great question. So I want to say, first of all, that we want to ensure accessibility, comfort, and safety to all people who are seeking the shelter, regardless of any particular demographic characteristics. But secondly, something that has been so wonderful to see across the country, and certainly in our experience locally, is how functional a non-congregate environment is for promoting safety during the operation, and also for providing really maximum flexibility in terms of who you're able to serve and how you're able to serve people. So I think providing the nature of non-congregate shelter means that people have their own space. And so it really promotes safety at the individual level, but also promotes safety at the corporate level across the operation.
Thank you.
I'm sorry, Ashley, let me also add that I think inclusivity is a real value that we hold, and it's a real value that we hold in this particular operation. So part of our objective here is to be sure that we don't develop an intervention that screens anyone out, but that instead we want to screen people in based on their need.
Thank you. And our last question for operations, once the shelter is in operation, how can the community provide feedback to the city about what's working and what needs attention?
So thank you, Ashley. I think most importantly, we want to make sure that people do feel comfortable speaking up. And you know, we are still in the middle of COVID, so we're having to do a lot of meetings virtually. We tried to get a lot of input from folks to hold this meeting, but we know our community has a lot to say, and we want to hear what you have to say. One of the ways that we are recommending, and the reason I said that is because we're open to feedback on this, but we're recommending that the city have an on-site staff person that is there just for the purpose of hearing from adjacent property owners about how things are going and hearing from the residents. So in addition to having an operations manager and the operational folks on site, we want to have representation from the city so people can speak up, people can know who to get in touch with, have a name, have a cell phone number of someone to address concerns immediately. In addition to that, we're recommending that there be security on site. So we would have security at the location and be able to provide and respond to anything that were to occur, not only for the adjacent property owners, but for the residents themselves. And so I want to make sure that I heard all of your question. But in short, I think we're trying to plan for making sure that the communication is open and that people are able to get in touch with somebody to address real-time issues and concerns that are going on.
Thank you, Kathy. So our next category and our last category for the night is impact. The last category of questions we have tonight is about the impact of the proposed shelter on homelessness, homeless individuals, and the community. Our first question, how will people graduate from this shelter to housing?
I can't overstate how important it is that people do graduate from the shelter into permanent housing. Again, that's our goal and everything that we're working on. And we have embedded a lot of that focus in the RFP because we want to be sure that we have a shelter operator who understands how to do that work and can help people identify the best housing option for them. What that means practically is that staff should constantly be talking to people about next steps in moving towards permanent housing. So ID is a really easy example of this. Ashley would certainly be able to speak to that. Many people who are unsheltered don't have a state-issued ID, and so helping people get that ID is an essential step in moving towards permanent housing. So just identifying what are the activities that need to occur in order for this person to be able to identify an apartment. Do they need employment? Do they need to pursue disability? Is there a part of town that is better or worse for them to live in? Are they able to room with someone who they may already know? Are we able to reconnect them to a support system, like a family member or a friend who they might be able to live with? Like, how do we identify the best option for this person to get out of shelter as quickly as possible when that option is safe and sustainable? And then what action steps do we need to take in order to move them down that path?
Our next question, what is the impact that this shelter will have on homelessness?
I think we're certainly anticipating that we will see a significant decrease in the number of people who are unsheltered in our community. And again, because we will have the opportunity to really connect with folks who may not be very connected to other systems right now, I would expect that we will see a decrease in the overall number of people who are homeless because we will be able to help people exit into permanent housing.
Ashley, can I follow up on Emily's answer?
Of course.
Just to add on to what Emily's saying, since we have started moving folks into hotels for shelter and for their safety, we've only taken in folks who were in the original encampments that were in city parks. So we have limited the number of folks who have gone into these locations with the potential for having all of the rooms that are available at the Ramada Inn. We have the ability to expand that capacity. So some folks, as I was listening to Emily, some of the folks may say, well, we still have homeless and you have a hotel. But that hotel is not fully occupied with the number of folks that we think we could end up having there. So, and I wanted to clarify this because, certainly we have a lot of folks who are still homeless, and we have a lot of folks who are still are in crisis and looking for something. And right now, the options that we have are really, the hospital or jail. And so we're trying to expand that by providing this service so that it can be open at night, because now it doesn't function that way. So I just wanted to clarify that the 88 folks that we have there, we've had there for approximately two months at least, I would say. And Ashley, you can correct me, but we haven't been accepting new folks to come in until we move further along in the process. Does that help just clarify for folks who are wondering, why do we still have homeless folks or folks unable to find camping or shelter? I'm sorry.
Yes, Kathy, because like you said, we don't even have half of the rooms that are available to occupy, because we still are running this with an active business. So the people that were moved from the encampments are the peers that we have there now. And especially on the Sunrise line, we get multiple calls, but we are able to direct them maybe to a different opportunity for them, or maybe give them an alternative for people who are wanting to come into the shelter. And we try to connect them to other services, just because, like you had said, it's for the people who were at the encampment. So.
Thank you both for that answer. Our next question: how can you assure that these individuals will be self-supporting and be contributors to our community after they leave the shelter? I think that's open to the whole panel.
Yeah, I can answer a little bit. Just working, one-on-one with almost every one of these individuals, as Tara and her staff can identify with as well. Like these peers want to work. They want to have an income. They want stable living environment for them and their families, or, for the moms and their children. Like they want to be productive members of this society. And I really feel like with a little bit of help, they can go a long way. I mean, the folks that I talk to and that I hear from are so grateful for what is being done for them, and that they weren't just put into a shelter for the night and asked to leave the next day, that they're actually given a little bit of support. Because for me, I feel like foundation is the ultimate thing for someone to be able to be successful, because you have to have a foundation to build on. And for our peers, giving them this foundation and somewhere to lay their head and not have to worry about all their belongings getting stolen, having to start over the very next day, like that's difficult for someone. So being able to build these relationships and let them know that they have people they can trust. They are able to open up and let us know what their needs are, because they actually feel like they're going to have some outcome in that. So I truly feel like that our residents at the hotel want to be members of our community and want to be working just like we are and providing, and have a stable home and stable income.
Yeah, absolutely. And I think the numbers obviously show, from the data that Ashley shared earlier, that we are providing or helping people find employment, and that's the information by the numbers. But the story of the people, I think, tells a much more impactful story of hope. And the people that we're able to meet, like one individual who's been homeless for 15 years, he lost his family in a tragic accident a long time ago. And since then, he hasn't been able to overcome that barrier. And so we're working with him on how to come to terms with that, how to get him to understand that he is enough, that he can have a different type of life. And so it's those types of conversations that you can't have with somebody necessarily on the street. That's the conversation that you have to have with somebody when they're safe and they feel supported in a structure. And this opportunity is providing that for these individuals in our community. And it's really amazing to see. And I have really exciting hopes for the opportunity that these folks have in their future.
Thank you, Ashley and Tara. Our next question: do you think this kind of facility would be a magnet for other homeless people from other places?
I'll step in on this one because I think that in probably 2 or 3 different settings I've had this question asked. This for me is, I think, just an answer that we have to answer based on data. I don't think it's the kind of answer that anyone across the board objectively could answer. So recently we were able to identify confidentially everyone that's in the shelter, where they come from, where their last address was, just to be able to understand the demographics of the folks we're with. And so what we found out is that of all of the individuals there, 77% are from Asheville or Buncombe County. So that's pretty significant in just looking at the pure data that's there. That tells me that this is not drawing people in. 9% of those were from Western North Carolina. North Carolina, other places in North Carolina was 2%, and then out of state was 12%. So the data itself doesn't suggest that. The other thing I would say is that we're not overbuilding a shelter. So it's not like based on the time and point count that Emily was talking about and looking at those that are unsheltered every night. I mean, I think we had, Emily, what was it, 114 or something in that nature? And so we would propose in this location, there would be 102 rooms. So I don't think there's going to be an opportunity for folks to come from other places because we're really just identifying the number of rooms to meet the need that we currently have. So I mean, that is how I would respond, but I would ask the other panelists to speak to their thoughts on this question.
I would agree. I just wanted to add to clarify what Kathy just shared, that all of those data are about where people last had housing when they became homeless. So that means 77% of the people who are at the Ramada right now are people who were living in housing in our community and lost that housing and became homeless. And I think the data that we see locally really match what we know nationally, that the majority of people, as Ashley said earlier, people want to be housed. People want to be stable in their lives. And often some type of crisis occurs and they lose that housing, but they are often in crisis in their own community. And so I think our opportunity here is to really respond to a local crisis.
Absolutely. I totally agree with Emily and Kathy. Just from, I could think of just, for instance, 5 peers off the top of my head, and all 5 of them went to a different high school in the Buncombe County area, whether it was, North Buncombe, Inca, Asheville, they grew up here, and whether they graduated or not from high school, like this is home to them. And like Emily stated, like there was some sort of crisis that led them to be unsheltered where they are. I know one girl, she lost both of her parents, and she was young whenever this happened, and she tried things on her own, and it didn't work for her. And there were some other extenuating circumstances, but she was from right here in our neighborhood. So, I truly believe in helping anyone, but especially the ones in our community. So like Emily and Kathy had stated, like we need to, we have identified the needs and the people in our community. And as long as we could keep the numbers for those being sheltered, I think it would be just a wonderful thing.
And thank you, Ashley, for sharing that personal anecdote and putting, some feeling with that as well.
Ashley, can I interrupt one more
Yes.
second? I'm sorry.
Of course.
I do want to clarify that we have heard that there's some other data that that has been collected around where folks were last housed. And what we want to say about that data is I think it was collected based on all of the homeless population in Asheville and not specifically just at this location. And it wasn't 100% of the folks who were at this location. So I don't want folks to be confused with numbers. We want to be very transparent and say that there have been other, there's been other data that's been collected. But in both of those cases, in our data overwhelmingly, but in the other data that has been collected, more than more than 50% of the folks are from our area, even in a smaller sample. So I want to say that the outcome of the data is the same, but I don't want folks to get confused with the fact that we're talking about the data that we shared is 100% collected from the residents at the Ramada Inn versus just a lower percentage of folks from that location.
Thank you to everyone for answering that question. Next question. Why would people be motivated to get jobs or move if they have a hotel room the city is paying for? How long do you think their stay would be?
I'm not sure on the stay, but I can speak on motivation. And a hotel room isn't theirs. It's not something that belongs to them. It's not a place they can call home. It is an emergency shelter, and it is a temporary solution to what their ultimate goal is. And that's just, the motivation is there. I see the people working for it. I see that they want it. And as long as we continue to support and help and push them in the right direction, I feel like that motivation is going to stay there, because in the end, everyone that I've spoken to truly wants a place to call their own. They want a place to decorate. They want a home. They want a place they can come home and cook dinner at. And an emergency shelter is not it. So I definitely see the motivation in people getting permanent housing.
Sorry, team, I hit the camera button and not the unmute button. Our last question. Some of the questions we've received want to know if there's an end date to this property being used as a shelter. What is the end date? Will this location always be a shelter when the city buys it?
I'll take the first stab of this. It's been very interesting working with folks since the beginning of the pandemic and understanding who has been most impacted by the pandemic. And we know that's even a larger group than our homeless population, but significantly our homeless population. We've known throughout history, at least even in my life's history, that we've gone through several situations where there have been different crises. There's been crisis of AIDS, there's been crisis of other pandemics, or not pandemics, but there's been other crises of health issues and needs. We don't know. To answer your question, Ashley, I think the thing that attracts us a lot to this property is it has potential to develop, that if we are able to help people find housing, it can transition as needed. It could become permanent supportive housing if we can get folks out of crisis and we see more folks who are becoming stable and the need changes within our community. There's the opportunity on this property to create permanent supportive housing and move people into that situation that Ashley was talking about, where they do have a place of their own, a place they can decorate. So that's another thing that attracted us to this piece of property is that it does have enough acreage, enough flat land for the community to be able to use it in the way that that it needs based upon the demand. So I'm very hopeful and optimistic that there will be an opportunity for this property to become permanent supportive housing at some point, and then maybe move into affordable housing at some level. Emily mentioned before, we look at this holistically from a housing function, and there's a whole spectrum, a whole system that folks go through. So we think this property could grow with our population and our community and could become something that it needs to be in the future. But right now, what we have identified this gap as being this crisis need, and that's what we're trying to provide.
Thank you, Kathy. That wraps up our questions that we have for this evening. But I do want to give everybody an opportunity if you wanted to say anything in closing before we log off. So anything from our panelists tonight?
I want to take. I'm sorry, and I know the other panelists with me may want to say something, but I want to emphasize again that we have got incredible partners out there that have been working for years to help our homeless population. And we have reached out to those partners, and we're very appreciative of all the work that has been done. We feel like this is a gap, but that all those other services are definitely needed in our community, and we support all those other services. So I just wanted to acknowledge that. I wanted to acknowledge that all of our partners who have stepped up to provide meals, have stepped up to do a lot of work for this population. And, the successes haven't happened by themselves. They've happened because people have showed up. And so I just want to acknowledge and say thank you to our community who have been so supportive of this process so far.
I'll just piggyback on that and say thank you especially to Tara and Ashley for participating in this conversation tonight, but really for what they are doing on the ground every day at the Ramada right now. Ashley and I talk every day and are just really, really learning a lot through this experience. And I think Sunrise has been so flexible about stepping up and partnering with us in this. And I think we have learned so many good things along the way. We've seen really positive outcomes along the way. And same with Goodwill. Tara didn't hesitate to just jump right in and bring her folks on site to get connected with people. So I definitely would echo everything that Kathy just said and wanted to particularly say thanks to both Sunrise and Goodwill.
And I just wanted to, again, say thank you for allowing us to be part of this project. I think what Ashley and Sunrise, what they've been able to do there has been amazing. And we've seen how effective sort of this holistic community approach can really be and how effective it's become over the past several months. And so we're providing a really small service that is really impactful. And I think, again, what Ashley and her team at Sunrise has been able to do has been great. So we're appreciative of having a small part of that.
And I will just say, thank you to Kathy, to Emily, to the city of Asheville in general, and, to everyone who is involved in this, because speaking for Sunrise and speaking of Sunrise, of the 50 employees that we have, I know that each and every one of us have lived experience in some sort of a way or another to what our peers may be going through. So for them to be able to see that a different life can be lived, I feel like it's very inspiring to them, and for us to be able to share a little bit about ourselves to them, that there is an end to all of this, and that it can be very bright and the future can be great. So I just want to say thank you to everyone that is involved, and we're going to continue to do the best we can.
Thank you, team. And just once again, we want to thank our panel and thank the community members who have sent in their questions. We appreciate you listening by phone or watching on YouTube to this community conversation. As always, if you would like to provide additional feedback to city staff, please email avlendinghomelessness@publicinput.com. Once again, that's avlendinghomelessness@publicinput.com. And we have a slide showing up. We had previously advertised an in-person meeting on Thursday. However, due to COVID-19 concerns, that meeting will now take place virtually. Our next meeting will take place from 5 to 7 p.m. Thursday, August 12th. You're able to listen live on our public input number, which is 855-925-2801. The meeting code is 4928. I'm going to repeat that number, 855-925-2801. And the meeting code is 4928. So you can listen on the phone to the conversation. You can also watch on YouTube or Public Input. The Public Input address is publicinput.com/AVL ending homelessness. And because that meeting was going to be in person and we were going to be able to talk to people, we will be allowing live public comment at that meeting. We just ask that if you are going to provide a live public comment, to please register at publicinput.com/AVL ending homelessness. There is a registration portion that will allow you to enter the speaker queue. So please use publicinput.com/AVL ending homelessness. That will conclude our meeting for this evening. Once again, thank you to everyone who has listened and those who are watching live on YouTube. Thank you to our panel. Thank you to our community. Have a safe evening. Goodbye.